thank you very much, Hiti and Dr. Sanu, madam. Yes, thank you so much. And at the outset, I would just like to thank, for the entire organizing team of Diabetes India for a fantabulous Diabetes India. I think we had a wonderful inauguration ceremony. Hats off to the entire organizing team. So, here, when the topic was given to me, I had so many thoughts, what is it? What is it? What I'm going to put in that? So, just to start off, as Rima Rao madam has just said, she goes and she Googles and she tries to find out new things. So, I just came across this picture, which was made by Leonardo da Vinci. That was way before 500 years before. And that time he had crafted this picture saying that this is the structure, the proportion of a human body. The geometrical forms, what he made, and imagine 500 years before he understood that this should be a human man with all these proportions, and that was the scientific precision and the art amalgamation which he came with this picture. So we all know that we've always dietitians. I think this is the favorite sentence of all our dietitians, that if the diet is pure, the mind is pure, and if the mind is pure, the intellect will be pure. So surely, whenever we are going to take things in our plate, we need to think and pick up what we are going to eat. So there is an intricate relationship between the diet and health. So way beyond, we used to say you are what you eat, but I think we have moved way beyond that, and it is now a complex interplay. There's lot of things evolving every day. So now there is now while reading this, it just came to know that there is so many the bioactive compounds, the nutrients and the non-nutrient factors which interact with each other, and there are genetic, there are epigenetic, there are environmental factors which trigger, and which is important in giving a wholesome diet. And now is the era of precision, when it is a era of precision medicine. This is the era of precision diet as well. So we need to look upon the different the different influence of the gene expression, the metabolic pathways, the disease susceptibility, different things when we are making a diet chart. So nutrition plays a vital role in the disease prevention and the management, as it's influencing, because there's a nutrition which modulates the gene expression and the epigenetics. There are dietary components which regulate the inflammation and the immune response. We know, okay, this particular diet causes more inflammation, so we are going to reduce that particular food in that. There are nutrition which impacts the gut microbiome and the metabolic health. There's also nutrition which influences the hormone, the regulation, and the metabolic pathways. So, over and all, there is a personalized nutrition which should be recommended for the particular disease, for the prevention and the management of that particular disease. So now is the time when we need to talk upon the nutrigenomics and the nutrigenetics. So nutrigenomics, basically it is what you eat influences your genes. So it is like it explores the interplay between the dietary nutrients and the genetic expression, how the nutrients will modulate your gene transcription, translation, and your metabolite production. Whereas the nutrigenetics will say that how your genes will influence and how your body will react to that particular food. So how the particular nutrient absorption, metabolism, and utilization will be taking place in your body. So here I have just tried to mention about the role of the diet at various stages of life. So when we think about diet, so COVID shook all of us and said, no, we have to wake up and we need to have food which is good for your health. So it's not about COVID. It's not about diabetes. When any of these non-communicable diseases knocks into your life, we get up. Okay, now it's the time we need to go to a dietitian and we need to follow a particular diet chart. It's not about that. It has to be started from intrauterine preconception. That is very, very important. So here I'm going to talk upon different things. So it's this is again a wonderful picture which says like about the undernourished mother and the overnourishment. So just going to read it out. So pregnancy, it's a multiplier of the unfolding pandemic of diabetes and non-communicable diseases, as it provides a crossover bridge. It's a crossover bridge or interchange between undernutrition in the previous generation. So maybe our previous generations were undernourished, but now the next generation are going to be overnourished, and through that there is gestational hyperglycemia, thus impacting subsequent generations with overweight, obesity, and other non-communicable diseases. So maybe that is the reason why these all things are coming to the newer generations. We always get that thought कि पहले तो नहीं था, अब क्यों हो रहा है, so that is there. This again is a very nice slide which we just saw. The parental, there is a contribution of the parent for programming the adult obesity, diabetes in the offspring. So the preconception, that is the preconception, the conception, that is your fertilization, embryo growth, the gestational, the lactation period, all these are critical time windows for the maternal obesity and the diabetes to shape the risk for the offspring to develop obesity in the diabetes. So, all these non-communicable diseases has to be thought way before the mother, or way before, the pregnancy is to be planned. So this is even the preconception period is a critical period for the parental for the parental obesity and the diabetes. So maternal as well as both the parents are equally responsible for shaping the risk of NCDs in the offspring. The metabolic environment also affects the baby. So this is again a very interesting thing. It's not only the woman, it's not only the diet of the woman, but the ova quality, the sperm quality, the intrauterine environment in the first trimester is very, very important, because there are endocrine disruptors which your lifestyle factors, your obesity, your alcohol, your all these, the wi-fi's, the laptops, and all these heavy metals which may cause lower in the sperm count and which may affect the aging male. So all these things are also important. So is there any impact of gut microbiome in the newborn? Yes, there it is seen that the GDM mothers may be influenced by the because of the gut dysbiosis. It can due to the high maternal fasting, because due to hyperglycemia, the high BMI values, their faulty dietary habits, it may cause the gut dysbiosis, and all this has been actually passed on to the baby, making the baby obese in their later life. So, as per the survey of National Nutrition Monitoring Bureau, this is the survey of the 10 Indian states. It has been seen that in India, half of the women are anemic. If I, look at this in this hall, I think I'm sure I'm going to get 50% of them are anemic, and only 40% of the women are hardly, only from 15 to 49 of years they are underweight, and 25% of the women are overweight. So again, we need to work more on the to getting a normal BMI pregnant woman also, and 50% of these pregnant women are consuming less protein and energy, and of course they have lower levels of your iron, folic acid, vitamins, and other micronutrients which are important at the time of the pregnancy. And moreover, the unhealthy and the cheap foods, which is very well explained by Rima ma'am, and these are the things which they are these people, especially in the pregnancy in the rural areas, they feed themselves with these cheap foods, because that is something which is easy to find, and ultimately that's giving rise to overweight and obesity. So this again is a cross-section study of 870 women, which has shown that there is a maternal dietary intake was positively associated with maternal nutritional status and fetal growth, both in the early and the late pregnancy. So good, healthy, nutrient-dense diet is important in the pre and the post-pregnancy period as well. Now, the gut flora it starts preparing, it's already prepared, not only in the intrauterine, but of course sets its stage at the intrauterine, but the dynamic period of gut microbiota, it's established in the first 2 years of life of a feet of a baby. And the second, and it keeps on pattern shaping in the first 2 to 5 years of life, and in the early childhood gut microbiota grows and diversifies, and in the adolescent, when the community of bacteria in the GI tract, it stabilizes. So these are the things which is important, and we need to see that we are feeding the baby with healthy food. And this is another good important line, that the newborn fed baby with the mother's breast milk have higher abundance of bacteria species compared to the formula fed children. Finally, it's the gut microbiota is again very, very important. Then we all know that the consumption of these high fat snacks, junk foods, irregular habits, having late night dinners, all this, the Swiggies and the Zomatos dropping in your house, knocking your door at night, 11 o'clock and 2 o'clock. This contributes to obesity and other metabolic diseases. Can you see there is lot of change in the tiffin itself, from the childhood. We've seen when I was a child, I used to just take roti, a paratha roll, not even sabji, sometimes aloo ki sabji or even achar paratha. Okay, you may say it is not healthy, but fine. Finally, that was the only thing what we used to have. But now the mummies are spoiling the babies with the whole lot of, okay, beta, abhi aapko kya leke jana hai kal? Okay, this is the whole thing, and everything, whatever the baby likes, is been put in the tiffin. So I think there we need to go back to our older tiffins. I think that's very important. Then the packaged foods I need not save, and the sugar sweetened beverages are the main cause of obesity in children. And we all very well know that 70% of the obese children will be obese adults. So, yes, it is the time to wake up now. Everybody likes a cute, chubby child, but yes, we need to think about the future as well. And there are a number of studies, the meta analysis of so many RCTs, which has said that personalized nutrition inventions based on the genetic data has reduced the cardiovascular disease factors, also reducing the LDL cholesterol and the blood pressure. Then this was another study of the 32 RCTs, which was found that the genetic variants influenced by individual response to dietary interventions, including changes in blood profiles and glucose metabolism. So if we go into the precision medicines, like then we will be able to fight against all these non-communicable diseases. And of course, there are a number of, the moment you find obesity and you are trying to google up some other diet, of course we have a wonderful talk later by madam, and there are different types of fats, and they think it's a magic bullet, as Honorable Jitendra Singh was telling us about the intermittent fasting, and they plan to eat so much. So I think there's so much of different types of yeah, diets which are there in the uh, and which is trying to actually do more bad than good. Then we have also the high fat diets may also lead to cardiovascular risk factors. They may increase your hypertension, atherosclerosis, and other issues as well. The Western diet, I think, ma'am was already told that yes, the Western diet, though it's rich in processed foods, red meat, and saturated fats, and there are RCTs which has found that a Western diet was associated with an increased risk of depression and anxiety, whereas the RCTs found in Mediterranean style was which is found rich in fruits and vegetables, has improved anxiety. And this is again a meta-analysis, a comparison of 14 popular named dietary programs for the weight loss, which has shown that over a period of 6 months, yes, there was a modest weight loss, but at 12 months, the effects of weight reduction and improvements in cardiovascular risk largely disappeared. So finally, all these fad diets, they are short-lived. They're done only for a very short period, and the compliance is very very important. There are unrealistic combinations like high fat, low protein, or maybe very high protein, high low carbs. So it is very unrealistic, and it cannot be followed for a very longer time. It is not very suitable, and of course, everything has to be done under a strict supervision of a health professional. Um, so again, what is the best diet to be used? It has to be rich in a health promoting food, which is a plant based food, fresh foods, which is locally made. It should be rich in antioxidants, nuts, sources of omega 3 fatty acids, and it should be low in saturated fats and trans fats. And this is something important. This is something what India eats, that the ICMR and IN guidelines, which we see that the rural is really filling its plate with the cereals, which is way too high. And when we see the urbans, yes, they are also filling the plates, but they are also filling the plates with number of ultra processed foods and your tubes and roots and tubers. So something what we need to take is India must eat something which is balanced. The plate method, we all know that's the best thing what we should follow. That's half of the green leafy vegetables and the fruits, and the other half, one fourth should be your cereals, and another one half should be your protein. So changing you changing who you are by what you eat. Yes, while you cannot change your DNA sequence, you can influence the gene expression by taking healthy dietary choices. You can modify your epigenetic markers. Um, you can shape your microbiome by influencing by taking foods which are healthy for your gut. So these are your important take home messages, that you can dietary patterns can influence epigenetic marks. It can affect your gene expression and disease susceptibility. The gut microbiome, yes, plays a crucial role in nutrient metabolism. You need to have foods which are rich in probiotics and prebiotics, and somewhere Mediterranean diet is again very important. And now we can actually, Mediterranean diet is nothing different. आप अपना खुद का Indian Mediterranean diet भी बना सकते हो. You just have to have lot of nuts. You need to have good amount of oils. We always say rotation of oils, and have fresh and healthy locally made foods. So finally, nutrigenomics promises to improve health outcomes through personalized nutrition strategies based on individuals' genetic and metabolic characteristics. Though I'm not a nutrigenomic expert, but maybe yes, we know one name who is very, she's an expert in that. So all the questions I think will go to her. So, anyways, there is no one size fits all. Diet has to be highly individualized. It has to be simple. It has to be structured, consistent as per the current eating patterns. It should have cultural preferences, locally available, and finally, everything, it should be meeting the metabolic goals. And mindful eating, of course, is my tagline, which should be done by one and all. Thank you. Thank you.